So you're talking about how you shifted from corporate to freelancing. For those who don't understand this, let me put some context to it. So you finished all your education, and then how did you end up in corporate hospital?
See,
What is a corporate hospital?
Yeah, see, corporate hospitals are like, I don't want to take any hospital name particularly. It's like a hospital which is mainly the show is run or the owner is run by some unknown person or a non-medical person like an MBA or a businessman or entrepreneur who just see it as a business module. Hospital is never a business module. First, we have to make it very clear. Then only we can treat and give a better life or a better situation to people. There they treat it as a business model. Okay, and in any corporates like offices, the employees are there. They have been set some targets. That set some work to be done. Just by luring them for a job or increment or post or other luxuries. The same thing, not exactly, but these people hire doctors for some amount as a special, okay, some amount we are giving you this salary, you come join. Especially when doctors after finishing their 10-12 years of journey and when they see, okay, brand, okay, this is a brand and I have to go and join it as a consultant. They promise, okay, they're promising me doing good marketing, good advertisement of mine that I am a specialist available in this hospital. Okay, so and after such a starvation of such a long time, you always want to your life to be comfortable. So you go and join, fall prey to it for a salary. And what salary they usually pay are peanuts actually.
Okay.
They get this with 1 or 2 or 3 patients and you work this thing for whole month.
Okay.
Yeah. And what happens is, okay, if you are getting good numbers, then okay. But still if you feel, okay, all specialties are not same. If you take a gynecology, the volume will be more. If you take a spine surgery, the volume will be relatively less compared to that thing. The generation of revenue. So they start pressuring you. Not all, but major. So start pressuring you, convert more cases. Some cases which are in gray zone, whether to operate or not, just push them for operate. Let patient decide, or let you only decide and push the patient. And you just bend your ethics or something like that.
But what does that do to you as a doctor?
So it's like even we were the targets for it, but we chose our path. Like, okay, I spent 10 to 14 years to learn what to do and what not to do. To say when to operate this patient. He's just some MBA guy or some non-medical, I'm not respecting other fraternity, but coming and assisting or telling you, sir, just push, operate, let you do more surgeries so that things will be better for you and hospital and maybe for the patient. This dictating, I think I didn't like. So that is the reason. I'm not blaming corporate hospital. Everyone has their own liabilities and responsibilities. But I didn't felt like, okay, I'm fit for this system. So that's the reason I came out. Now I'm working more hours than what corporate hospitals are 9 to 5 job. Then after 5 you can just go home, play with your kids, have a drink and take your dinner and sleep. But here I work at least 14 to 16 hours a day.
Okay.
Hardly even Sundays also, if there are any cases or any emergencies, have to run, travel, go operate, see patients, talk to them and come. But that's okay. But at least here what I am doing, what I learned and what I love and what I'm passionate about.
Okay.
So that gives me good satisfaction, good sleep.
That's wonderful.
Yeah.
You were talking about freelancing where you're working for 16 hours. Can you run us through how that works? How do you make money out of it?
Yeah.
Not the exact numbers.
So obviously, so freelancer means not bound to any particular hospital or not bound to a particular salary or a particular working hours. If I'm an hospital owner, if I've employed you, your duties are fixed. Patients are coming or not, you have to come at morning 8, stay till 6, take this particular salary, or bound to me or not bound to any other hospital or not see a patient outside my hospital. I mean, these are the steps. A freelancer means it's like he can work, he can choose his hospitals, go meet that hospital. Okay, there are particular hours I can come or a particular time where patients will be coming. You call me and take my appointment. So certain hospitals where near my house or where in area which my clinic is or where I practice, I cover some 7 to 8 hospitals where okay, visiting consultant Dr. Mithun, a spine surgeon, will be available on call. Because if you need, if there any patient coming in emergency where needs a spine intervention or orthopedic intervention, or in certain orthopedic, some hospitals I go twice a week for 2 hours, scheduled time. So when patients get tuned, okay, this doctor will be available at this hospital. I go see patients, talk to them, whatever their condition, see if any patient is getting converted to surgery, after that I operate. I go at my convenient time, take rounds. I coordinate with that hospital's in-house doctors to have a look. They'll be watching, I'll go and taking rounds and guiding them for the further treatment. With this, both are comfortable, me and hospital. Why? Because they are catering on specialty. They like a spine without being, I am being their liability. Means they don't need to pay me even if I'm working or not working. They don't need to pay me. I am asking only for which the patient I have seen. My OP charges, my operating charges, and my round charges, which I'm coming, seeing patient, talking to them. This is my operating charges I write, and I give the package according to patient's. Best thing is, same surgery I do for a certain amount, same surgery I do for double the amount, same surgery I do for 50% amount.
Based on the
Patient's requirement, patient's social status, and patient requirement.
Okay.
How this varies is like, suppose, an example. I am wearing a Reebok shoe and you are wearing a Bata shoe, like an Indian company, Bata. Both are good. Both have their almost similar life. Only thing, Bata comes at around 50 rupees or 100 rupees. Same Reebok shoe comes at 1000 rupees. So it means just for nominal sake.
Yeah, sure.
So this, but the quality of the thing is same. The surgeon, operating surgeon is same. If I tell, okay, if you want in a bigger corporate hospital, the operating charges will be more because you have to spend for that hospital. No, sir, I want the same surgery in a smaller setup. So we can do it in a small setup.
Okay.
The quality of treatment is same, but other non-medical amenities like, oh, you have a nice big AC room in a general ward. You have a very good TV or a receptionist coming and talking to you. There is no receptionist. But you are intended for what treatment you will be getting without compromising the quality. This is the thing. So there's so much of freedom here. Means you can cater a very, like I treat even a security guard in a private, he don't have an insurance, he don't have money. I operate the same techniques, the same technology, the same surgery, and to him and to his owner also.
Okay.
I have that liberty. I get 5,000 rupees, for example, I'm happy enough, 5,000, okay. 1 hour surgery, anyhow I'll be taking lunch and taking a nap for 1 hour. I'm operating one way. 5,000, but I'm making his life better.
True.
So this freedom you get in a freelance practice. You dictate, you set your terms, you decide which patient to treat, and no burden. One dark side of this is long working hours, and you won't get a lot of money which you expect. What would be this guy is working for 12, 14 hours. He must be making money like anything. It's not like that. But coming to satisfaction and work ethics satisfaction level, I have double than others.
Okay.
And I have operated almost like since my fellowship and everything, we have operated, it means this last 2.5, 3 years since I've started freelance, I operated more than 1,000 spine surgeries. More than 1,000 with a logbook.
Okay. That's a lot.
Yeah. So that's the thing, because I'm able to reach more people. I'm able to do my work more happily. I'm able to do more risky cases. It's all like how we want. So that's how freelance helps.
Okay.
Yeah.